So all of that cost, right, between the financial or economic costs, the burden on all of these systems, legal systems, health systems, the cost to individual families, and some of the other healthcare costs that aren't related to overdose, but do include illnesses. People who use drugs are more likely to contract and spread those. Sorry, I'm trying to think of the word. The communicable diseases. Sorry, that's what I was trying to think of. Communicable diseases. And so part of the rise, particularly in terms of harm reduction, is the rise of hepatitis B and HIV, like in the 80s. I think hepatitis B was the 70s, and then HIV, of course, grew to notoriety in the 80s. Really started to give rise to the importance of prevention and harm reduction. That essentially, it's not realistic to expect everybody to abstain. And even with HIV, that it's not just the intravenous drug users, but also it was the unsafe sex practices. So one size kind of fits all, that here's, if everybody just abstains, then it will be fine. So that's, certainly the most effective way to prevent a bunch of these harms, at least related to substance use, is to not use, right? That's ultimately it. But that's not a very realistic solution. And I was going to say one other thing. Oh, and then, part of that, I think that, because of all of these costs, it is very concerning, right? That we all are thinking, oh, wow, people who misuse substances, like, we should be concerned about that, right? But part of the problem is that American policymakers have viewed drugs as all bad, right? For the most part, they're bad, and therefore legislation is aimed at either outright banning a drug or, limiting access. And there's different ways we did that, and I'll talk about that later. But this war on drugs, set policies and legislations that criminalize manufacturing, growing, possessing, and selling drugs, and that abstinence-based treatment programs were the mainstay, right? And the just say no to drugs, and everything was very, this or that. And so all of that has contributed to the stigma associated with substance misuse, limited access to assistance by pushing abstinence-only programs. So, people don't always want that, right? And the criminalization, not just of possession, but even the use of drugs. So these have been viewed as the only answers, and clearly that's not really worked. So what do we mean by harm reduction? Hawk published several articles about harm reduction from a public health, kind of talking about from that public health and a healthcare perspective. So the focus being on those various harmful consequences. So that includes trying to reduce the transmission of those communicable or infectious diseases, preventing overdoses, and particularly overdose deaths, minimizing criminal activity and incarceration by providing care that is intended to be stigma-free and centers really on the needs of people who use drugs. So you will see, I guess I didn't put it right there in that slide, but PWUD is the acronym you'll see from here on out, which is people who use drugs. So part of it are the kind of interventions, the maybe perhaps, direct clinical care, that's maybe related to us as clinicians, that there are harm reduction strategies for us as interventions, but it's also a social justice movement. So talking about, advocating for different policies and changes and promoting various programs that are aimed at reducing these harms, and instead, trying to educate people to not be so afraid of some of those programs. So we'll talk about that in a little bit. So, instead of saying like drug use equals harm, the target really is the negative consequences of the use, I guess, as opposed to like eliminating the use. So we tend to pathologize the drug use. So I don't even mean just people who might qualify for a substance use disorder, that people who use drugs are viewed as like that they all are labeled, druggies or whatever label you want to use, looked down upon. So patronizing, it's kind of looking down on them, blaming them for their own use, impose our own kind of moral judgments, our own value system, right? Like why would you do that? We criminalize not just, manufacturing, but we do criminalize possession. And generally, there's a lot of fear around people who use drugs, right? And so that ends up isolating and marginalizing them. Sorry, I'm just trying to think if there's anything else. And one other thing about criminalizing people who use drugs, from the source I have, that they mention that, if we're thinking that someone can be, quote, saved by, quote, hitting rock bottom or calling law enforcement, or even excluding them from programming, that we are further marginalizing that person. That made me think about even like mandated treatment. So we used to say, and there was a thought, like I spent many years, I started working in the addictions field in 1992. So there may be some of you have been in it longer than I have, but that's still quite a while. And so back in the day, we, used to think about that, like, oh, maybe they just have to hit rock bottom before they're really ready for treatment. And that isn't necessary. Their chances for a successful recovery are better the sooner you intervene, right? But also, I worked with mothers who had addictions. I worked with a special program in Illinois back in the mid-90s. And my Illinois people, I don't know if you heard of Project Safe, but I used to work for one of those in Southern Illinois, and I loved it. It was one of the best jobs I ever had. But the women I worked with, and we did have, we were part of a research project that Bill White was running, if anybody's familiar with Bill White. And I think he wrote The Culture of Addiction, Culture of Recovery. So I remember doing a focus group with him one time and talking about our women. And we said, people talk about hitting rock bottom, but our women say we live on the bottom. So women with addictions, and particularly these mothers, like there was so much trauma involved for them. And some of them were being victimized even while they were in treatment with us. So, there was no rock bottom. It was, that wasn't what had to happen. Like, they just needed help. They needed somebody to support them and help them and not judge them. Right.